I was a ear, nose, and throat surgeon by training, and all of our patients had smoking-related illness, mostly cancers. And so I was touched, starting 30 years ago, by the impact of tobacco on people who smoked. My first career was all about tobacco-related, illnesses and surgical management. The second career was a lot of esophageal cancers are caused by, at least in China, by poor air quality. And so those patients that develop those cancers have to have a very aggressive surgery to treat them. They have their entire esophagus removed. And so our procedure helped eliminate that with a 15-minute endoscopy to prevent these cancers from forming. Today there's about 100,000 of those procedures done every year, and the company's now owned by Medtronic, which is a really large medical and surgical device company. So I turned 50 when I left, and my wife and I, we've been thinking about tobacco use and what the massive impact globally is on health, just this massive problem. And I really had a lot of deep thinking about, could I not leverage this surgical training and academic background that I had, and then this entrepreneurial background. I decided that I could not try to innovate in the tobacco use prevention space. You have to. I can't think of another product that's legally sold in the United States that if you use it according to how it's intended to be used, that it results in your death 50% of the time. Big Tobacco sells about $50 billion worth of tobacco products in the United States. 50 billion with a B. For every dollar they sell, we all pay $6. That's not right. So the only way to help eliminate that incredible disparity is help people quit. There's about 40 million people in the United States that smoke. And we know that about 70% of them say they want to quit. It's probably higher than that. And about half of the people that smoke try to quit every year, and the majority fail. And there's a very simple reason that's the root cause of failing to successfully quit smoking. It's because it's really hard. A lot of people attempt to quit on their own without help. They try to do it with no preparation, cold turkey, and the majority of those folks end up returning to a daily pack-a-day cigarette habit. And so if we could just get the best practices of helping people quit delivered to all smokers, the proper counseling, the proper preparation, the skills, the peer support, a human coach, the proper medical therapy, will change the world. It will deliver the best practices through your phone with a human coach in your phone to help you prepare and then quit and then stay quit. No one's ever done that before at a scale, like millions of people in the US and in the world in the future. The one really interesting additional technology around our approach is that we have a carbon monoxide breath sensor that is Bluetooth connected to your phone and to the app, the Pivot coaching app, that measures the amount of carbon monoxide in your bloodstream, which is directly related to how much you smoke. And it's like Fitbit for smokers. It gives a person who smokes a real quantified self number and image about their own behavior. And it's been the number one, according to our users, the number one thing that's provoked them to really start thinking about their smoking. We want to help all smokers. Even the folks that don't want to quit, when they come through our program, their motivation is enhanced. And they're like, wow, I didn't think I could do this. I'm actually really thinking about quitting now, and really, tell me more. There's a photo on our door in the office that has 3 jumbo jets. And those 3 jumbo jets represent the number of US adults that die every day of smoking-related illness. Cardiovascular disease, cancer, you name it. 1,500 people fill 3 jumbo jets a day that die of smoking-related illness, all preventable. So worldwide, 48 of those jets crash every day. 48 jumbo jets every day in the world of people who die of smoking-related illness. It's crazy. So I think if you ask, what's the thing that gets everybody here up in the morning? It's that. Saving lives. We have packed Pivot with stuff that works. There's thousands of peer-reviewed papers, from JAMA, New England Journal, all the way down through other journals that and guidelines that showed that all the stuff we packed using our medical advisory board's expertise works to help people quit smoking. Works. We believe we're going to save millions of lives. I was really excited to learn that American Lung is not just about tobacco use prevention. It's about clean air. It's about healthy work environments. It's about lung fitness and fundraising for research. And I'm really impressed with what I've seen so far. ALA has a much broader vision than I had realized, which is wonderful. I mean, I'm really behind all of the work that ALA is doing.